We're starting a new chapter at Eyewitness News. For nearly 70 years, of course, we've been committed to telling you meaningful stories and digging deeper into issues that affect our community. And today, we're launching WCTV Investigates.
Our investigative team will search for the truth, hear from diverse voices, and find solutions. Tonight, we're looking at an issue that's becoming a key topic of this year's legislative session: communities considered medically underserved.
Nobody should have to go an hour, 45 minutes, whatever, when they have a cough or they woke up and they spit up a little blood and they just have a question on what's going wrong.
Our Zach Dahlheimer and photojournalist Sam Thomas have been talking with people and doctors all across the Big Bend. Zach, you're also going through data suggesting Florida has a dire need for doctors.
Hey, good evening, Jacob and Julie. Yes, that's right. And we obtained a report by the state's Office of Program Policy, Analysis, and Government Accountability. It says in part that recent studies have found the number of physicians in Florida can't meet demand. In fact, one study estimates Florida will have the second largest physicians shortage in 2030 among all states. Now, as lawmakers talk healthcare access in this year's session, our team has been speaking with doctors and residents who say they've seen firsthand how resources for primary care are scarce.
I'm a man of, I guess you could say, many faces.
Scott Goodland is a product of Jefferson County, Florida, a portion of the Panhandle just north of 15,000 people. Serving as a volunteer firefighter in Wassissa, Goodland is proud to call this home.
It's kind of like old-time America where no matter who you were, somebody knew your mama, somebody knew your daddy, and you weren't going to get away with anything.
The same goes for Tammy Brookins, who's called the county home for 20 years and lives around downtown Monticello.
Anybody will do anything to help anybody. The 6 degrees of Kevin Bacon. In Monticello, it's 1 degree.
And while you can find plenty of scenes like this around the county, Goodland believes one resource is in short supply.
There is such a limited amount of resources when it comes to primary care. So I can sit here and tell you that I've never had a primary care physician in Jefferson County. I have had my primary care in Tallahassee for most of my life.
We asked how long his drive would be to see a doctor.
It would probably take me means of 30 to 45 minutes to get there, depending on traffic.
What if that doesn't work?
Oh, it is what it is at that point. You literally have to budget your time to get there. And I'm very lucky. I have a vehicle that works. I have a steady paying job. Nobody should have to choose between health care and a paycheck.
So I've lived it.
Family medicine physician Dr. Alma Littles recalls experiencing the issue firsthand while growing up in Gadsden County.
Probably the majority of the health care I got early on in life from the school nurse. I saw that there were so many people who were suffering from illnesses that seemed like they should have been preventable and even dying, from them.
Healthcare access in rural areas and underserved communities is a priority for Littles, now the interim dean of FSU's College of Medicine.
How big of an issue are underserved communities here in the Big Bend?
There are huge areas where there are not physicians, where there are no physicians for those patients, and they do have to travel long distances.
For several weeks, WCTV Investigates has been looking through data related to this issue, including the latest physician workforce annual report released this past November by the Florida Department of Health. The report represents a summary of results from physician workforce surveys doctors are required to complete as part of their license renewal process happening every 2 years. The 2023 report includes survey results and analyzes more than 56,000 physicians providing direct patient care in Florida.
They're able to show where physicians are practicing, in the state, what areas of practice they're in, and therefore able to highlight those places that really have a shortage.
Data from this report shows out of those 56,769 total represented physicians, more than 8,100 practice family medicine. But how do Jefferson County and other nearby counties shape up? Out of more than 8,100 family medicine physicians statewide, only 1 is accounted for in Jefferson County in the report. That's compared with 4 in Madison County, 6 in Taylor County, 7 in McCulloch County, and 162 in Leon County. We asked Dr. Littles about Jefferson County.
Would certainly consider it an underserved area.
I know other people are struggling, other families struggle, where we've been fortunate. We've been very blessed.
Brookins says she's a patient at TMH Physician Partners Primary Care in Monticello.
We realized that patients were not getting the primary care they need.
Rob Moss, TMH's Executive Director of Physician Partners, has been proactive with others about getting health care into rural areas in the Big Bend for 30 years.
We did try to locate ourselves as centrally as we could in most of those counties to basically make it available to anybody in that county.
We found their primary care office in Monticello currently has 2 family medicine physicians and a physician assistant.
It provides easier access for the residents of that community to get care locally. That's where people want to be treated. When you wake up in the morning and you're sick, you want to drive 30 minutes to Tallahassee. You want to go down the street and get your care there.
But like Dr. Littles, Moss believes that Jefferson County is underserved.
You have about 2,500 patients per provider. We also have a PA in there that also picks up. So we're probably covering close to maybe half of the, not quite half of the population.
Brookins believes any improvements for healthcare access would be good, but is satisfied with her current options.
I think the population would have to be larger in order to sustain a larger medical practice here.
We need more resources for the entire county, not just the city.
If we're not focused and paying attention, it will get worse.
Now, we have reached out multiple times to the Florida Department of Health to speak with us about the report we referenced in our piece. We're still waiting to hear back. In part 2 of our investigation, we speak with Florida State's College of Medicine and TMH doctors about what they're doing to help rural and underserved areas. You can catch that tomorrow right here on Eyewitness News at 6.
All right, Zach, yeah, really looking forward to that. And this is something that people in our communities have been talking about for so long, right? They just don't have that hometown doctor.
Making that trek to Tallahassee can be impossible for so many, as you outlined there, something we take for granted. Thank you, Zach, and we'll see you tomorrow.
We're looking at those rules surrounding areas to looking at those pockets, and those are the areas that we want our students to realize that they still need physicians.
Our new WCTV Investigates team is going in-depth on an issue that's a big talker right now among state lawmakers, doctors, and everyone in the Big Bend. Healthcare can be especially difficult to access in areas considered underserved.
Last night at 6, we explained the issue at hand, and tonight our Zach Dahlheimer is back to explain what solutions are in play to make sure people in our area have primary care options. Zach?
Well, good evening, Julie, Jacob. Both TMH and Florida State's College of Medicine have strategies to get students into rural and underserved areas. Our photojournalist Sam Thomas and I got a closer look at the difference they're making.
I love what I do, and I definitely feel like it is a calling.
Dr. Laura Davis's connection to medicine developed at a very young age.
The doctor that I took over from here in Blountstown, Dr. Cliff Bristol, is actually the doctor that delivered me.
Growing up in Calhoun County, Davis eventually found her way to Tallahassee at FSU's College of Medicine. After graduating in 2013 and a residency stint in South Carolina, she came back to where it all started in 2016. Now a family medicine physician at TMH Physician Partners Primary Care in Blountstown.
Just getting to pour back into the people that you see in the grocery store and the people that you sit beside in church, that's special and not something that everybody gets to experience.
She says she and others at her practice see between 20 to 25 patients a day.
The rural setting is just a unique setting to be able to pour into people. We don't have public transportation. We don't have hospitals that do colonoscopies and procedures, and you have to love on people in a rural setting a little bit differently than you would in a larger setting. Sometimes people have to decide if they're going to pick up their medicines or put gas in their car.
3 family medicine physicians represented Calhoun County in the 2023 Physician Workforce Annual Report from the Florida Department of Health. The report also states, based on data, Calhoun is one of 4 counties in Florida where at least 1/4 of physicians represented plan to retire within the next 5 years. While Davis believes Blountstown has a good number of medical providers in town, she thinks the Big Bend is medically underserved.
Calhoun County, where we are right now, is a rather large county, and when you think that the vast majority of the medical care is all right around the Bluntstown area. Some patients, even within our county, are driving 30 minutes to be able to get medical care.
Bringing physicians in the community enhances the economic status of the community.
For FSU College of Medicine Interim Dean Dr. Alma Littles, healthcare access in rural and underserved communities is top of mind. She says one solution for tackling this is attracting prospective students from rural areas to return and practice.
Individuals who are from those smaller communities, rural communities, underserved communities, are also more likely to go back to those communities to practice.
She also spoke to the school's regional campuses, including rural training sites, one of those sites being in Marianna.
As a part of our educational programs, we place students in those communities for parts of their training so that they get introduced to what it's like to be in a rural community, what it's like to live in a rural community. We have a number of those who either themselves grew up in rural areas or were introduced to it when they came to medical school between their 4 years of training in medical school, and made the decision that those are the populations they really want to be able to serve to make a difference.
They pour into students from rural areas with that hope of sending exemplary physicians back into the rural setting, and so I think they're thriving in that. I think it's important to find where your passion is. Not everybody wants to practice in a place like Bluntstown, but not everybody wants to practice in a Jacksonville or a Tallahassee either.
Those students are being taught the latest and greatest in healthcare. If they can bring that to rural counties and rural areas across the state, everybody wins.
We previously introduced you to Scott Goodland and Tammy Brookins, two people living in Jefferson County. Goodland thinks more family medicine providers are needed for the county, while Brookins believes the focus should be on more transportation resources rather than providers.
I think that's an easier problem to fix than to try and hire doctors here to get a transportation system that's more user-friendly to go to Tallahassee, to go to those appointments.
Meanwhile, TMH officials say there are ways they're attracting doctors to the Big Bend.
We are able to, being a not-for-profit, we're able to help get them loan reimbursement for being in a rural community. So it helps the physician pay off their loans.
And this month, Florida state senators approved the Live Healthy Act, which, among several things, expands several programs to attract more professionals, including residents and nurses. As this year's session continues, doctors like Davis and Littles are hopeful for the future.
What's your message to FSU College of Medicine students as well as lawmakers here in the state when addressing this issue?
Don't forget about, those people who it might actually be easy to forget about. And remember that, they need health care.
Now, TMH officials also told me they are focusing on Jefferson County and are looking at maybe adding another provider as long as the supply will support it. And we have more from Dr. Littles, as well as more information on how FSU's College of Medicine is helping serve the underserved right now on this story at WCTV.tv.
And so, Zach, what is next for that Live Healthy Act?
Well, Julie, senators approved it last week, and the House is working on its own version, and any differences will need to be sorted out before it heads to Governor Ron DeSantis' desk.
All right, a lot on the table. We'll keep our eyes on this and perhaps do a follow-up down the road and see how things are improving. Zach, thanks so much. And if you have a tip you'd like to share with WCTV Investigates, you can submit a tip on our website or news app, or just email us. The address is news@WCTV.tv. We'll be right back.